So you talked about you've seen patients that have had surgery and said, "What's going on? I still have pain. The surgery was supposed to be the fix." We always tell patients there's no guarantees in surgery. As soon as you cut somebody open, we've seen amazing recoveries and incredible spine surgeries, and we've seen one that haven't gone that well. Same thing with joint replacements. I think maybe that's the most frustrating because our patients will get a joint replacement. They've heard from their neighbor, "Oh, I had terrible pain, and now I can do whatever I want." And then they have a joint replacement, and then it doesn't go the way that they were expecting. Is there treatment for that? Or is it, hey, man, we did the joint replacement. There's not much I can do. You're kind of stuck with it. Talk about patients that you see after surgery.
Absolutely. And one of the things I always tell patients, when you have pain after surgery, it does not always mean the surgical procedure has failed. The body goes through neuroplasticity, so the nerves relearn the structure, the joints, the new metal, or sometimes parts of your body could be removed so that you actually get relief from the symptoms. The body has a new state, a new anatomy, a new physiology to interact and work with. So, what I always tell patients is when you have pain and symptoms after surgery, like numbness, tingling, sometimes it's restriction in motion, where the function is impaired. It doesn't always correlate that the surgery went wrong. It could just require that there's other aspects that needs to be treated and managed after surgical procedures. Very often, I'll tell you, when patients have back surgery and they still have pain, there is a condition called persistent spinal pain syndrome. And it doesn't mean that the surgeon did not do a good job, but it just means that there is just a bunch of wiring in the lower back that you're going to have to help after surgery so that the patients can actually get better in due time. And it's one of the reasons why, even after you get certain kinds of back surgery, it takes about a year. The surgeon will tell you it takes about a year for you to really get back to where you are, and it's going to take physical therapy. It's going to take pain management. So we see a lot of patients that come in with pain after back surgery. Another thing that could work in scenarios like that is we actually target the nerves that are angry after, post surgically, and we try to deaden those nerves. We try to retrain those nerves, whether it's using a stimulator, whether it's using heat to eliminate the nerves. And those nerves are very smart because they grow back. But what's nice is then patients can function and the symptoms can be better. The same thing applies to the knees. Patients come in and they have persistent pain after like a total knee replacement or a shoulder surgery. It doesn't mean it's a failed procedure. If the procedure has failed, obviously you want to talk to your surgeon and get more advice on how to manage it, maybe a revision. But if the surgery was successful and it still hurts, it's not unusual to have neuropathy, to have neuralgia or very painful, angry nerves around the area where you had the operation. And when you come to pain management, one of the things that we do, our job is to isolate those nerves and again, directly treat, mitigate the pain so you can actually function and even in most cases go back to physical therapy so that your body can actually learn how to work with the new adjustments to your anatomy. So I hope that answers your question. But there's just so many options. Persistent spinal surgery is one of the things that we see after back surgery. We also see CRPS, which is called complex regional pain syndrome. Usually, there's a region of the body that is affected, whether it's the knee, the ankle, the shoulder. It is not unusual. And again, you may even have neuropathy after injury during surgical procedures. And injury in this case doesn't mean that it's a bad practice. It's just that surgery by itself is injury to the body. And in the process of healing afterwards, you can develop neuropathy, and that's very common. And we have several things to help manage those presentations.
So